The representative from North Carolina, Ms. Adams, is recognized.
Thank you, Mr. Chairman, and thank you to our witnesses for being here. And before I begin, I want to enter into the record a joint statement from the National Organization on Federation of Child Care Program, with 42 organizations that want federal child care programs. Mr. Chairman, I want to do
Without
that.
objection.
Thank you. I'm listening to my colleagues, and I've got to tell you that, yes, we got to pay people. Congress knows what it needs to do. We need to step up. We can't sit in here and talk about we need child care, and yet we're not doing what we need to do to make that happen for people. But having said that, let me just say that there is a child care crisis in this country. Child care costs far too much for working class families, and early educators barely make enough money to keep a roof over their heads. Working hard is not enough if you don't make enough. We got to pay people. It's shameful that in the wealthiest country in the world, most people can't afford child care. This is no accident. It's a policy choice, but it doesn't have to be this way. During the COVID pandemic, the American Rescue Plan Act made historic investments in our child care system, but these investments were temporary. We need to go back and bring them back. And since the expiration of the ARPA funding, the child care crisis has only worsened for both families and early educators. In North Carolina, the average child care worker makes around 7% less than in 2019. As a result, our state has 6% fewer early educators than in 2019. At the same time, child care costs have increased by almost 25% in the past 3 years. The Trump administration and House Republicans have only exacerbated this crisis by cutting staff at Head Start and weakening our already insufficient social safety net. Low pay leads many child care workers to rely on public assistance to survive. Researchers at Berkeley estimate that 43% of early educator families rely on some kind of public assistance like SNAP or Medicaid. Ms. Mantuzzi, can you explain how the big ugly bill, that's what we call it, that's what we know it to be, will affect early educators and the child care system more broadly?
Thank you for the question, Congresswoman. As you noted, the H.R. 1 made significant historic cuts to SNAP and Medicaid, which are some of the benefits that child care workers rely on to support themselves and their families. As you noted, they're paid so little that often early educators are leaving the profession to work in retail, to go work at box stores. The other aspect of H.R. 1, which is important for child care educators, is that it did ramp up resources for detention and deportation for immigrants. And because about 20% of the early care workforce are immigrants, that puts additional pressure on the workforce.
Thank you, ma'am. So ensuring all families have access to high quality, affordable child care means that we need more child care centers and more seats. And what level of infrastructure investment is needed to make child care more accessible?
Thank you for the question. Notably, the Child Care for Working Family Act would make significant investments both to ensure provider and child care teacher pay, but also have grants so that more child care providers can open their doors and offer solutions to families in their communities. Great.
The lifetime wage gap for women in the United States is almost $500,000. And there's over $1 million for Black women. So can you explain how the lack of affordable child care options in the United States disproportionately affects women, and in particular women of color, and how robust federal investment in child care, as proposed by the Child Care for Working Families Act, could reduce lifetime gender earnings gaps?
So caregiving is kind of disproportionately borne by women. And so what we have seen is that when childcare is less available, when childcare is more expensive, women tend to be the ones that drop out of the workforce in response and provide unpaid caregiving. Conversely, we have seen that if universal childcare has been offered, research demonstrates that will cause more women to work full-time, full year. That raises their lifetime incomes, and it increases their retirement benefits and Social Security.
Great, thank you. So fixing our child care system is going to be expensive, but it seems to me that providing high-quality child care to all Americans will have a strong return on investment. So could you quantify the effect that accessible childcare would have on the economy?
We know that having reliable, accessible, affordable childcare helps families, puts more dollars in their pockets, it supports the workforce, it helps employers, it grows the economy. If the United States made investments in care more broadly, same as other high-income European countries, it could increase women's employment, and that would grow the economy to the tune of over $700 billion a year.
Well, thank you very much. Enough said. I appreciate it. Thanks very much. I yield back, Mr. Chairman.
Representative